Hi, I'm Chase Huey with RGAX, and I'm here to talk to you today about the concept of predictive experience studies. Basically, looking at and exploring the idea of how we as an industry can keep up with the incredible rate of change that the rest of the world is experiencing. We are living in unprecedented times. And while that's very exciting for us as individuals, it can be very scary if you work in an industry that is trying to predict and mitigate risk at a population and global level. For us to have some context in terms of how much the world has changed over the last number of decades, we really have to focus on the evolution of the digital tools that we use on a day-to-day basis. Most of us are familiar with Moore's Law, which basically just measures the number of transistors on an integrated circuit and how that number doubles every 2 years. That number has predictably done so over the last number of decades since this idea was put forward. And in 1971, each integrated circuit had less than 10,000 transistors, whereas now it's over 10 billion. The AI algorithms that are the backbone of most of the digital solutions that we interact with today have also increased in their computing power. Between the year 2016 and today, the sophistication of the models that train the AI that we leverage have increased in their computing power and complexity over 100 million times. This rise in technological efficiency and proliferation of digital solutions has also had a corresponding impact on the larger world outside of pure digital solutions. For example, the cost of sequencing the human genome has gone from $100 million in 2001 to less than $1,000 today. It has also been an enabler of a myriad of other innovations. If you look at the utility patents filed in the United States, from the 1860s to the 1950s, there were, on average, less than 500,000 US patents issued per decade. And in the 2010s, it was nearly 3 million. This marks an exponential growth rate in terms of the proliferation of new variables and solutions and innovations in the market. Now, why does this matter to us? As we've just found out, the increase in proliferation of digital technology has a corresponding increase in the availability and volatility of factors affecting all of us in this world. Now, how are we as an industry to keep up with such factors, and what tools do we have at our disposal to meet this challenge? The way that we in the life and health insurance industry make sense of all these factors is to conduct actuarial analyses and experience studies. Normally, to conduct an experience study, you would be gathering and preparing your data, performing exposure calculations, calculating the actual figures relative to the expected figures, creating some study outputs, analyzing that, checking it, validating the results, and then finally producing a report on revised assumptions in pricing and mortality and morbidity rates. Normally, actuaries will look for about 100 deaths as a dependent variable in order to make a conclusion about whether or not an attribute has actually had a material impact on that. Now, so that means that if you had a death rate of about 1%, you would need to have about 10,000 lives in order to have a cogent decision on whether or not an attribute has affected that mortality in any meaningful way. In age bands of 80 years old and older, it's fairly easy to find 100 deaths per population amount, but as populations get younger, you need larger numbers of lives before you get that because of the statistical death rates. Now, what this means is that not only is it harder to predict the effect of some kind of attribute on younger populations, but it also corresponds with the fact that younger populations will spend more of their lives in a highly variable environment with more and more attributes affecting human mortality. These times are unprecedented. For most of human history, human beings have been passing away from predictable factors: old age, cardiovascular disease, cancer, accidents. But now this rising volatility in attributes affecting morbidity and mortality is affecting our ability to predict it, because the rate of proliferation of these factors is outpacing our current ability to predict them using traditional means. Think about it this way. This is probably the first time in human history in which large populations of people who are alive today will die from things yet to even be invented. How are we to keep up with this velocity of change? Thankfully, there may be an opportunity to leverage the very technological innovations that are disrupting our industry in order to save it. Now, I'd like to talk to you about 3 technologies with the potential to help provide positive disruption in our industry and allow us to adapt to the evolving volatility in the marketplace. Artificial intelligence and machine learning, supercomputing and quantum computing, and in silico medicine. Now, many of you are already familiar with AI, artificial intelligence. This is a general descriptor for any kind of algorithm that is designed to mimic human intelligence for problem solving. There's also machine learning and AI that is designed to solve complex problems and be able to leverage that learning in order to extrapolate and potentially even predict. That is what we're really interested in for the purpose of this conversation. Now, there's multiple ways in which these machines or algorithms will learn, either through supervised learning or unsupervised learning. Supervised learning is really there when a human intervention is required, helping to teach the algorithm, providing it inputs, and getting the outputs in a form of predictive analytics. So this is a lot of fit-for-purpose elements. Again, as you see, there's these similarities between a fit-for-purpose solution or more of an expansive, evolving problem-solving solution. Now, different than supervised learning is unsupervised learning. That does not require human intervention to train. Why is it so important that it's unsupervised, and why is that really what we want to focus on in this industry? Well, it has to do with this force multiplier of time. If a human is required to educate a model, then 1 second of a human's time needs to be 1 second of the machine time. It needs to go in, and it can't move forward unless a human is moving it forward. With unsupervised learning, it's operating on machine time, which means it's much more compressed. And this relative time factor allows the machine to conduct calculations much faster to a larger degree and is only limited by the computing power of the machine involved. This time compression is key because without the requirement of human intervention, the machine can operate, and the only bottleneck for efficiency, as I mentioned, is computing power. But with the rise of supercomputing and potentially quantum computing, we can live in a future where we assume that computing power is infinite. I won't spend any time talking about quantum computers specifically. Really, the only thing to know about them is their computing power is such an evolutionary step forward to supercomputers that we can expect this growth in computing power to be a persistent trend, and for computing power to not be a limitation in our decision making or our technology use in the next 10 to 20 years. And the final piece of technology I'd like to talk about today is in silico medicine. In silico medicine is really just a fancy term for in silicate medicine, meaning on computer chips, done via computer. It's a form of artificial intelligence applied to biological systems. In silico medicine is already being used in order to better understand drug responses within the bloodstream, to predict outcomes, to innovate new medicines by running large-scale simulations on biological systems or protein variabilities. What in silico medicine means for the industry and for society at large is really the application of supercomputing and innovations in AI to biological systems. And it allows for a shortcut on that compressed time horizon we talked about to be able to conduct analyses much faster than you would be able to do in a clinical trial with actual human beings on human time. So let's bring all 3 of these together in order to get a clear picture of what we can expect from the future of our industry. Artificial intelligence and machine learning is going to continue to give us the tools we need in order to operate at speeds and make an impact faster than we ever have before. Computing power is going to continue to proliferate and rise in its level of sophistication, meaning that computing power is not going to be a barrier for innovation in the years moving forward. And in silico medicine is just one example of how these technologies are being leveraged in order to simulate, make sense of, and predict biological systems that normally would have to operate on real-world time. As these technologies continue to proliferate and work in conjunction with one another, biological and natural systems can be analyzed, predicted over a compressed time horizon. Imagine a world in which you're leaving work on a Friday afternoon, and you need to conduct an experience study, not looking backwards, but potentially looking forwards, in which you input into a system that you want to look at 10,000 lives within a certain age bracket with a variety of assumptions in terms of their overall makeup of demographics, pre-existing conditions, and you simulate 30 years of human life and a variety of random events, and then look at the analysis on Monday, in which 10,000 lives have lived 30 years of compressed simulated time based on some focused criteria. Sounds like science fiction, but again, with the proliferation of the technologies mentioned above, nothing is impossible. This is just one of the ways in which we could leverage these technologies to help our industry meet the demand of a highly volatile and fast-changing world. Now, how can we work towards this future and ease the transition into this brave new world? Here are some thoughts and tips on how our industry could potentially adapt to this future and leverage these tools for our own benefit to maintain competitive advantage in this evolving landscape. Number one, track the marketplace. And we don't just mean track the insurance marketplace, because innovations, especially when they are disruptive, tend not to come within your industry, but outside of it, in a parallel industry or in an industry that is applying an innovative new technology in a novel way in your space. We have to return to basics as an industry and understand that our value at its core is our ability to predict, price, and make an impact on human morbidity and mortality. Now, if others move in and are able to do this at a larger scale, at a higher velocity, at a greater level of sophistication, then the entire bedrock falls apart in terms of our ability to add value. And I don't mean to say this to be alarmist, but I do want the audience to take this seriously, as these disruptions often don't come at you head on, but they come at you from the sides, from sometimes where you least expect it. Number two, design your organization to be ready for experimentation. Be flexible and look for ways in which to adopt these technologies or experiment with them on smaller proof of concepts. Pick small problems that these can solve and leverage point solutions where applicable. Number three, work with regulators. As a reinsurance innovator, RGA and RGAX often finds itself brokering conversations between large numbers of carriers and large numbers of regulators across a market, across the globe. And it's often amusing that we hear the same complaints on both sides of the aisle, that regulators want to be included earlier because they want to enable innovation, they just want to be kept in the loop. And carriers say, we'd love to involve regulators earlier, but they don't want to enable things, and we're trying to get things done faster. So both sides are sort of complaining that the other one isn't including them, and if they did, everything would move much more quickly. We highly encourage everyone in the audience to take this seriously and encourage you to work with regulators to find forums in which industry carriers, incumbents, and regulators can work together in order to make sense of these solutions, develop that expertise, and understand the impact it's going to have on the industry, and figure out ways to use it responsibly so that we aren't taken off guard. But having that expertise is critical. We have to bring in the regulators. We also have to bring in talent that understands and has experience in working with these technologies and understands how they could help, and also the potential risks, both to our companies, but also to the well-being of everyone that we insure. And finally, number four, just be creative. Really think through in your organization, engage in brainstorming, design thinking, and creative explorations of how these solutions can potentially impact. Simply building it into your strategic planning to think through the what-if scenarios, the sci-fi scenarios of how our industry could be disrupted in the 10 years will make your organization more nimble, more creative, and more adaptable to these changes. Okay, so in closing, today we talked about three main technology innovations: artificial intelligence and machine learning, supercomputing and quantum computing, and in-silico medicine. And we talked about how those three together really paint a picture of a disrupted future in the world of insurance, reinsurance, and actuarial science. I encourage you to take some of these thoughts seriously, and if you are interested in learning more, there's a variety of resources out there on these topics. And if you are ever interested in conducting proof of concepts or design sprints or new product innovation and ideation work, to reach out to us at RGAX, and we can help you make sense of the future.